Good morning, everyone. I'm Dr. Bautista, and welcome to the orientation on your critical appraisal project. So this is a group project, and each section will be divided into 3 groups. Each group will evaluate an article on one topic in your subject, Pediatrics 3A or 3B. You will be choosing one topic from the semester's modules, but we will be assigning specific modules per section. The presentation will be sometime 1 to 3 weeks before the final examination. And you will be submitting an output 1 week before the final exam. So you will have your presentation and then your written output. Your critical appraisal project will comprise 3% of your final grade in pediatrics. So for Pediatrics 3A, there are 3 sections, and each section will have, again, as I have said earlier, 3 groups, and we have assigned specific topics for the sections, okay? For example, for section G, one group will be assigned PET, another one neurology, another one allergology. Now you can choose any topic under PET, any topic under neuro or allergology. The same thing goes with the other sections. Now for Pediatrics 3B, so there are 5 sections and 3 groups per section. Okay, so you will have different major topics and you can choose one disease for that topic. Now you will notice in section C, 2 groups will be discussing about virology A. So you can discuss in the class between the 2 groups that you will not have an overlap on the topic, okay? The same thing with section D. 2 groups will be choosing virology B. And for section E, the 3rd group will choose either an oncology or endocrinology A topic, but be sure that you compare your topics and that's there no overlap so that there will be no same journal to be appraised. This is the rubrics that we will use during your presentation, and okay, so this will be your guide. Now for the actual appraisal, these are the output contents that we expect in your presentation and in your written report, okay? I will discuss this further in the subsequent slides. Okay, so just some guidelines. So in your presentation, okay, each answer to the appraisal question must be supported by, it could be phrases or statements or tables or graphs from the article, okay, supporting your answer of yes particularly, okay? Now, the relevance of each appraisal question must also be mentioned, okay? Why do you think it's being asked, okay? Not just answer with a yes or a no. So during your presentation, attendance is required. Participation during the Q&A is, of course, highly encouraged. And the professors can call anyone in the group during the Q&A. And each group may assign 1 student to present. So some guidelines, you should choose a full text article, not just an abstract, okay? So if the full text is not available for free, you are not required to buy or purchase an article, okay? You can ask for access from our librarian, or you have to choose a different topic. You should choose only published peer-reviewed articles, okay? And it should be an analytic study, okay, on therapy, harm, prognosis, or diagnosis. Now, what appraisal tool will you use, okay? We will allow you to use free downloadable tools. If you can access them, you can use them. but choose a free downloadable tools. These are just some of the tools that you can use, okay, depending on your scenario. Again, since we want you to focus on analytic studies, of course, you should not be appraising descriptive studies in this project. And we also discourage systematic review and meta-analysis. We just want you to work on one primary study. Now, you will have to submit the journal citation or the PDF copy. If it's just a journal citation, make sure that we can access the full text article of it for free, okay? Submit it at least 1 month before the presentation, and it's for approval by the consultant assigned. And for the research coordinators, we have Dr. Baita and Dr. Katapang, okay? I'm not just sure if they are still assigned the same subject. So just some examples on clinical scenarios that you will formulate, okay? So this is one on therapy, okay? So the scenario is in the emergency room, okay? And the ones involved are the resident, the patient, and the parent, okay? So you will notice that in the scenario, it ends with a question that you will answer in your appraisal. Another scenario on harm is a boy, a 5-year-old boy. So there is brief history, okay? And then who should be asking the question? It could be the resident, the patient, or the parent, okay? So again, it ends with a question that you will be the reason for you to search for an article. This is one example on diagnosis. Okay, so where will you search your full text article? So we recommend these sites where you can have access to free full text articles. So in your search, you can go to the advanced search option and try looking for the major topic on population, intervention, or outcome. So you will probably take a screenshot of your search so we can see it, okay? The search terms and strategies and the search output. So in your presentation, we expect to see this table. When you appraise directness, be sure to identify the population, the intervention or exposure, and probably with comparator and outcome, your PICO, okay? And this is your scenario, and this is one from the article. So just some guide, if you are being asked about if the two groups being compared are similar, you can always refer to table 1 of the results and compare the characteristics of the two groups. If you encounter the question about effect of treatment, it actually refers to the risk ratio or the odds ratio or the adjusted odds ratio. If an adjusted odds ratio and odds ratio are both given, please choose the adjusted odds ratio. Sensitivity and specificity, these are also being referred to as effect of treatment or the mean difference for continuous variables. If you encounter a question about precision, it actually refers to the 95% confidence interval or the range of effect of intervention or exposure or the standard deviation. So in interpreting precision, we say it's precise if the 95% CI is always beneficial or always harmful. It becomes imprecise if sometimes it's beneficial or harmful or no effect, or always beneficial but with very wide confidence interval, or always harmful but with very wide confidence interval, okay? So you might need to create a 2x2 table, just a guide. The first column heading is the outcome. The first row heading is the intervention or exposure. It could be, exposure. In the previous one, it is intervention. Or for treatment, and this is usually for risk or prognosis. Or this one for diagnosis. Okay, the first column heading is the presence of the disease, and the first row heading is the index test. Okay, so you might be asked to compute for the number needed to treat if we're talking of therapy studies. And I think that's my last slide. Thank you very much. And you can reach our resident coordinators for clarification.